Hello there, welcome to ShineTech's YouTube channel. In this video, we're going to look at introduction to pathology. So in this video, we're going to define what pathology is. And then from there, we're going to look at the steps in the evolution of disease. And then from there, we're also going to look at cell injury, cell death, adaptation, and cell adaptation. And then from there, we're going to finally look at the causes of cell injury. So to begin with, let's define what pathology is. So pathology is simply the study, a scientific study of disease, scientific study of disease. So in pathology, we study diseases. So what is a disease? A disease is simply an abnormal variation in structure or function of any part of the body. So if there is an abnormal variation in the function or structure of any part of the body, that is called a disease. And a disease will take 4 evolutionary steps. So these are the steps, they are evolutionary steps in a disease. So the first step is etiology, and then from there the disease is going to progress to pathogenesis. After pathogenesis, we have morphologic change, and then from there we have a functional derangement or clinical significance. So these are the evolutionary steps of a disease. Okay, so we're going to look at these steps one by one in detail. So these are the 4 aspects of the disease. Okay, so let's start by looking at etiology. So the term etiology simply refers to the cause or the causes and modifying factors which are responsible for the initiation and progression of a disease. So when you look at this term etiology, what should come into your mind is the cause of a disease. So etiology is simply the cause of a disease. And if the cause of that disease is known, that is referred to as primary etiology. And if it is not known, then we say it is idiopathic. Okay, so that is all about etiology. Then from the cause of the disease, we move on to what we call pathogenesis. Okay, so pathogenesis is simply the mechanisms through which the cause operates to produce pathological and clinical manifestation. Okay, so the mechanisms, the processes through which the cause, okay, through which the etiology operates to produce pathological and clinical manifestation is what we call pathogenesis of a disease. So, and this pathogenesis could take place in latent stage or incubation period, which is the period from exposure to the first manifestation of signs and symptoms, that is incubation period. And the latent stages are from exposure to subclinical onset, that is what we call latent stage. Okay, then from there, from pathogenesis, we are going to progress to what we call morphologic changes. Okay, so we have looked at etiology, we have looked at pathogenesis, which is the mechanisms through which now the cause operates to produce what we call clinical features or clinical manifestations, which are the signs and the symptoms. Now those mechanisms are what we call pathogenesis. So after pathogenesis, we are going to proceed to morphologic changes. So morphologic changes, these are structure alterations in cells or tissues. So it can be in cells or in tissues that occurs following pathogenesis. Okay, so we have the cause, and then that cause causes what we call the etiology will progress to pathogenesis, where the mechanisms takes place. Now those mechanisms are going to cause alterations in the cells or tissues. Okay, now those alterations that which occurs following pathogenesis are what we call morphologic changes. And these morphologic changes, they can be gross morphologic changes or microscopic morphologic changes. So those morphologic changes which we are able to see with our naked eyes are what we call gross morphologic changes, and those ones which require the aid of a microscope for us to see the changes which has occurred in cells or tissues, then those are called microscopic changes. So from morphologic changes, we move on now to the last evolutionary step of a disease, which is functional derangement and the clinical significance. So here now we have the morphological changes in the organ will now influence the normal function of the organ. Okay, the morphologic changes in the organ influence the normal function of the organ and determines the clinical features. So from the morphological changes, we have alterations in the cells and tissues. Now those alterations will bring about what we call clinical features, which are the signs and symptoms of a disease. Okay, and then from there, clinical features also have a cause and prognosis of the disease. Okay, so those were the four aspects of a disease, or we can call them the steps in the evolution of disease, which are the etiology. We have etiology, and then we have pathogenesis, morphologic changes, which are of two types: gross morphology and morphologic change, and we also have microscopic morphologic change. And then from there, the last one is the functional derangement or clinical significance, which are the signs and symptoms now the disease has developed. Okay, then let's also look at the next part, which is cell injury, cell death, and adaptation. But before we look at this, let's summarize the last part where we said we have talked about the evolution or steps of a disease, which are the etiology. The first one is etiology. So etiology, or the cause of the disease. A disease can be caused by a lot of things, and one of them is trauma. Okay, trauma can be a cause of a disease. And then you have toxins, which can come from chemicals or from microbes. Then from there we have infections, we have immunological abnormalities. Those are some of the environmental causes of a disease. And then from there we have genetic abnormalities. All those are going to lead to what we call etiology. And from etiology, we're going to progress to pathogenesis, which involves the mechanism of a disease. What happens after that cause has been introduced in the body? What mechanisms takes place is what we call pathogenesis. Then after pathogenesis, which are the mechanisms, are going to cause alterations. They are going to cause changes in the tissues and cells. Okay, so those changes are what we call morphological changes or morphological abnormalities. Then these morphological changes are now going to lead to what we call clinical manifestations, which are the signs and symptoms. So in a nutshell, that is all about the steps in the evolution of disease, or we can call them the four aspects of the disease. So let's now move on to cell injury, cell death, and adaptation. But mainly we're going to focus on cell adaptation in this video. Okay, so we have a normal cell in the body. Okay, so that normal cell, if subjected to a stress, that cell is going to adapt to that situation, to that environment. Okay, there is a stress which is stressing the cell. Then that cell, first of all, it will adapt to that situation. Okay, let's say there is a chemical which has been ingested, or a drug. Okay, so the cell will try to adapt to the environment, and then from there, if it fails to adapt, then it is going to have a reversible injury. Okay, so if that stimulus is injurious, then the cell will be reversibly injured, meaning this injury can be this cell can be reversed to the normal situation, the normal way, or the cell can reverse to its normal functions. Then from there, if the injury is severe, then the cell is going to be irreversibly injured. Okay, so if it is irreversibly injured, that cell can't be reversed to its normal way or its normal function, then eventually that cell is going to die. Okay, so that will lead to cell death. So a cell can die in two ways, which is by necrosis or by apoptosis. Okay, yeah. So but in this video, our main focus is cell adaptation, of which if a cell is stressed, the first thing would be to adapt to that situation. Okay, and then cell adaptation is of four types. We have hypertrophy, atrophy, hyperplasia, and metaplasia. So these are the four types of cell adaptation. Okay, so what is cell adaptation? So cell adaptation, these are reversible changes in the number. Okay, so it can be in the number, size, phenotype, metabolic activity, or function of cells in response to changes in their environment. Okay, so a cell will try to adapt in several ways, either by a change in the number, in the size, the phenotype, or metabolic activities, or even a function. Okay, so the changes in the function, size, number, and phenotype of cells in response to changes in their environment is referred to as the cellular adaptation. And as I have already said, it is of four types. Cell will try to adapt via hypertrophy, atrophy, hyperplasia, and metaplasia. So now let's now look at what really these types of adaptation are. Like hypertrophy, what is hypertrophy, what happens, and what are some of the changes the cells undergo in hypertrophy, atrophy, hyperplasia, and metaplasia. So let's now start by looking at atrophy first as a type of adaptation. So under atrophy, the cell will try to shrink. This is simply shrinkage in the cell, in the size of cells by the loss of cell substance. First of all, this trophy is simply means growth, and this A means reduced. Okay, reduced. So atrophy is simply reduced in the growth of cell substance. Okay, so the cell, this is simply shrinkage in the size of cells by the loss of cell substance, that is atrophy. Or in other words, you can just say reduced in the size of the cell is atrophy. Then from there, atrophic cells may just have diminished function, but they are not dead. Okay, atrophic cells are not dead. They may just have diminished, reduced functions. Okay, but they are not dead. But now, what are the causes of atrophy? Reduced in the cell substance, reduction in the cell substance. What might cause that? Okay, so some of the causes here we have decreased workload or disuse. Okay, so if the cell is not used, it is going to reduce in size. It is going to be atrophied. Okay, reduced or decreased workload. Like for example, if the heart overworks, what will happen is that the myocardial tissue is going to increase. That is hypertrophy, so it is going to increase. But in some other parts, if the cells are not used, then they are going to undergo they are going to be atrophied. They are going to reduce in size. Then from there, the other cause is denervation, okay, loss of innervation to the cell can cause atrophy. Then we also have diminished blood supply. We know that blood supplies nutrients and oxygen to tissues. Now, if that supply is reduced, automatically the cell is going to be atrophied. Then the other thing is inadequate nutrition. Inadequate nutrition, you do not have adequate nutrients for the cell to increase in size, so the cell will be atrophied. Then loss of endocrine stimulation. Okay, that cell is no longer stimulated, then it is going to atrophy. Then aging, which is senile atrophy. In old age, mostly cells will undergo or be atrophied. So those are some of the causes of atrophy. Then from there we have what we call hypertrophy. Okay, so hypertrophy, hyper, that is increased. Then trophy, we said it is growth, so increased in the growth. Okay, so hypertrophy is an increase, okay, an increase in the what, in the size of cells, resulting in an increase in the size of the organ. So we have an increase in cell size, meaning hypertrophy is simply the opposite of atrophy. In atrophy, we had reduction in cell growth, and then here we have an increased growth in the cell. Okay, then there are no new cells which are formed in pure hypertrophy. In pure hypertrophy, we do not have new cells which are formed. Okay, just larger cell containing, okay, just larger cells. Okay, the cells will just increase in size, then they are going to contain increased amount of structural proteins and organelles. Okay, so the organelles are going to increase in size, and then the structure proteins are also going to increase. Okay, so hypertrophy occurs when cells have a limited capacity to divide. Okay, most organs which have limited capacity of cells to divide, that's where mostly hypertrophy takes place. Okay, so hypertrophy can be physiological or pathological. So under physiological hypertrophy, we have like for example skeletal muscle tissue in bodybuilders. Okay, so skeletal muscle in bodybuilders where becomes hypertrophied, like they increase in size, as we are able to view muscles of a bodybuilder. So that is an example of a physiological. It's a normal thing, it's not an abnormal. So when you talk about physiological, meaning it's a normal thing. Okay, so skeletal muscle tissue in bodybuilders is simply an example of physiological hypertrophy. Now, pathological hypertrophy, here we are talking about abnormalities, something which is not normal. So we can see pathological hypertrophy in cardiac enlargement, in hypertension, or aortic valve diseases. Okay, so in cardiac hypertension, we have an increased blood pressure. Okay, so the heart is overworking. So due to overworking, the myocardium is going to increase in size. It is going to become hypertrophy. Okay, so it's going to increase in size. And then in aortic valve disease, there is stenosis of the valve there from the left ventricle to the aorta. We have what we call the aortic valve there. So if this valve is not functioning properly, okay, then the heart will have to pump blood with high pressure so that that blood can flow in that valve, in that defected valve. So to do so, it has to increase its muscle tissue. Okay, its striated muscle tissue has to increase in size, so that it overcomes this obstacle which is on the way, which is called aortic valve disease, aortic valve stenosis. Okay, the valves have become rigid, so they are not functioning properly, so the heart has to pump blood with strength, so that will cause the cells of the heart to be hypertrophied, okay, to increase in size to overcome that obstacle, that derangement which has occurred there. So we can see pathological hypertrophy in aortic valve diseases and also in cardiac enlargement in hypertension. Okay, so that's all about hypertrophy. Now let's move on to what we call hyperplasia. So hyper, also we are talking about the increase, then pleasure is simply number. So here we are talking about the increase in the number of cells. So an increase in the number of cells in an organ, okay, in an organ, that stems from increased proliferation. So this increase should come from proliferation, okay, where we have cells which are dividing and then the number of cells increases. That is what we call hyperplasia, and it can also be physiological or pathological. So physiological hyperplasia, here we are talking about proliferation, okay, normal proliferation of cells, like for example proliferation of glandular epithelium of the female breast at puberty and during pregnancy. We normally see breast being enlarged. That is an example of a physiological hyperplasia, the increase in the number of granular cells in the breast of a female. That is an example of physiological hyperplasia, and that is called hormonal hyperplasia. Why? Because it is stimulated by hormones. Okay, there are hormones which are responsible for stimulation of these cells to undergo what we call hyperplasia, and that is hormonal hyperplasia. And then we also have another example where we have residual tissue growth after removal or loss of part of an organ. A good example here is the liver. So if the liver is damaged or you cut a piece of the liver, it is going to grow back. It is going to grow and go back to its normal structure. So that is what we call compensatory hyperplasia. So hyperplasia is of two types: have hormonal hyperplasia and compensatory hyperplasia under physiological hyperplasia. Then from there, hyperplasia can also be pathologic. Okay, can also be pathologic. And examples of pathologic hyperplasia, here we are talking about endometrial hyperplasia. Okay, endometrial hyperplasia, which is the lining of the uterus, which we call the endometrium, increases in the number of cells there increases after the menstruation period. There in females, the endometrium is going to increase, the cells there are going to increase, and that is what we call endometrial hyperplasia. But now, if this thing is abnormal, if we have abnormal production of ovarian estrogen and suppression of progesterones, what will happen is that the number of cells in the endometrium is going to increase. It's going to be excessive. Why? Because we have excessive stimulation of release of estrogen, and that is going to cause what we call endometrial hyperplasia. And then we are going to see bleeding. Okay, we're going to see vaginal bleeding. That is now what we call endometrial hyperplasia, and it can lead to cancer. Okay, then from there, apart from endometrial plasia, this pathological hyperplasia can also be seen in benign prostatic hyperplasia in males. This is caused by androgens. Overproduction of androgens is going to cause benign prostatic hyperplasia. So these are the examples of pathologic hyperplasia. Then from hyperplasia, we have what we call metaplasia as a type of cellular adaptation. Okay, so metaplasia is simply a change in which one adult cell type, okay, it can be epithelia or mesenchymal cells. Okay, so we have a change in one adult cell type is replaced by another adult cell type. Okay, so we have a cell type which is being replaced by another type of another adult cell type here. Okay, so now this type of cellular adaptation, in this type of cellular adaptation, a cell type which is sensitive to a particular stress. Okay, so a cell type which is sensitive to a particular stress is going to be replaced by another cell type which is better able to withstand adverse environment. So we have a stress, okay, a stress which is being applied on a sensitive cell type. So that sensitive cell type is going to be replaced by another cell type which will be able to withstand, okay, that adverse environment. Then that is what we call metaplasia. Okay, so it arises, okay, it arises by reprogramming of stem cells to differentiate along a new pathway rather than a phenotypic change of already differentiated cells. So here we have reprogramming of stem cells are being reprogrammed to produce a new pathway, okay, new types of cells. Okay, reprogramming of these stem cells to produce new types of cells, not from already differentiated cells, okay, but from the stem cells. The stem cells are going to differentiate, to replace the already differentiated cells. That's how this mechanism of metaplasia takes place. Then we have, it is of two types. We have what we call connective tissue metaplasia. Have connective tissue metaplasia, which occurs in mesenchymal cells, where we have bone occasionally formed in soft tissues due to accumulation of calcium. This is mainly seen in muscle tissue, where if we have accumulation of calcium, then we are going to see bone formation in that tissue, in those soft tissues, due to accumulation of calcium. Then the other type is epithelial metaplasia. So we have connective tissue metaplasia and epithelial metaplasia. So epithelial metaplasia, this one occurs in habitual cigarette smokers, those who frequently smoke, okay, where the normal ciliated columnar epithelial cells of the trachea and bronchi are often replaced by stratified squamous epithelium. So we have a sensitive tissue type, which is ciliated columnar epithelial cell, which is being replaced by another epithelial cell type, which is stratified squamous epithelium. This is done to adapt to the current situation or to the environment in where now we have smoke, okay, in cigarette smokers we have a stress, okay, as in form of smoke. So this sensitive ciliated columnar epithelium is going now to be replaced. The stem cells are going to form new cells which are stratified squamous epithelium to replace the ciliated columnar epithelium, and that is what we call epithelial metaplasia. Okay, so thank you very much for watching. Don't forget to like and subscribe and leave your comment in the comment section. See you in the next video, where we're going to talk about cell injury and cell death.